One of the hallmarks of pathological gambling is impulsivity or impulsiveness. Impulsivity is often defined as acting without thinking, but there are other ways of defining impulsivity too, and one of those is a concept that we call discounting delayed rewards. When you discount a delayed reward, it's kind of synonymous with immediate gratification. You're more likely to take what's in front of you rather than waiting for a bigger reward later in time. An example of this that we use in the laboratory and in treatment studies is I might ask somebody if they would prefer to have $500 now or wait 1 week to get $1,000. The vast majority of people would probably wait 1 week to get $1,000. Now, if I ask the person if they would prefer to have $500 now or $1,000 in a year, that answer might change a little bit for some people. Some people might say, oh, I'll take the $500 now, and some people might say, I'll take the $1,000 in a year. Now, and then I would go on and say, would you prefer to have $500 now or $1,000 in 25 years? In this case, the vast majority of people would probably take the $500 now. Well, we can use this concept of discounting delayed rewards with problem and pathological gamblers. There have been a number of studies that have looked at this concept with pathological gamblers, and the vast majority of them have found that pathological gamblers discount delayed rewards at a much greater rate than people who gamble without problems. Now, these findings are very similar to the substance abuse literature, for example, with people who have cocaine dependence or alcohol dependence. And there are tremendous implications for treatment. For example, impulsivity has been shown to be significantly related to treatment dropout, to relapse, to other sort of negative characteristics among problem gamblers who don't successfully complete treatment, for example. So one of the things that could be suggested is, for example, that problem gamblers who are more impulsive may not initially benefit from setting up long-term goals in treatment when they first come into treatment. One strategy that we often use, for example, is to help the problem gambler to sort of address some acute issue, to come up with an initial positive outcome, an initial success that will take a relatively short period of time. From there, the treatment provider can sort of build on that initial success and start to help the client come up with slightly longer goals and slightly more involved goals that might involve a longer period of time. And with that, it's also important to be able to assess impulsivity among problem gamblers because some problem gamblers are more impulsive than others.